I was at the Howrah Tai Whānau Rural Health Conference last year. Jahan was emceeing, and then I heard, which was one of the most meaningful talks I've ever heard at a conference, about storytelling. And I approached Jahan afterwards and said, nurse practitioners, would you be willing, able to support us to raise the profile, the visibility of nurse practitioners and help them to tell their stories? Yeah. I think we've got an abundance of evidence internationally about the nurse practitioner workforce. There are now nearly 400,000 in the United States, growing in other countries. And here in New Zealand, we are seeing late but rapid growth in the nurse practitioner workforce. We have now nearly 900 nurse practitioners. Next year, we will have 1,000 NPs and more. And nurse practitioners are a solution to some of our health workforce and healthcare issues at this moment in time. Nurse practitioners have a great reach into our communities. Nurses are everywhere, and nurse practitioners are advanced practitioners who live, work in their communities. They deliver the full gamut of primary care services, meaningful, comprehensive primary healthcare services with a nursing lens as well as that biomedical lens. They're able to refer, they're able to prescribe, and they're connected well with whānau and communities. Well, traditionally nurses have been quite quiet and almost invisible at times about the work they do, the contribution they make. I think it's critical at this time that we hear their voices, that we hear their stories, that we actually hear from them about the work, the mahi that they are doing for whānau within communities. It's extensive, it's exciting. I think the nurse and the nurse practitioner makes them incredibly approachable. They're trusted, they're valued by not only their patients, but by whānau, by communities. And I think that reach into communities, that approach to healthcare that incorporates a strong focus on social justice, on equity, is really critical in our lives today. I think it's really critical that as an organisation, the organisation understands the role of a nurse practitioner. It is different from a doctor. There's lots of crossover. The roles are very complementary. I would say that it's important to consider that transition process from registered nurse, advanced nurse, and then into a scope of practice that is new and different. And we found through our research, through our work with the NPs, that first year of practice, that first year of transition into a rural practice is really important. So getting the connections with other NPs, peer support from colleagues in the practice, working with the NPs, with the community to work out, so where would be best to use this NP to meet the needs of that community. And I think if together the practices and organisations work together with the NP, you will come up with some really incredibly innovative and effective models of care. It's been a fabulous experience. So we've had 5 workshops: Whangarei, South Auckland, Taupo, Christchurch, and now here in Silverstream, in the Hutt Valley. And the energy from the nurse practitioners has been incredible. This is one of the first professional developments that has focused on leadership, on visibility, and I think it's been really well appreciated. We must have had a good 130 nurse practitioners attend the workshops, and more of nurse practitioner allies and champions in that space. But it's been really fabulous, and I have enjoyed every single one. Where to from here, I think, is collecting and collating their stories and starting to gain visibility through that space. I hope we've engendered some enthusiasm and some positivity for the NPs around them as being solutions to healthcare.
I think it's important to get the stories of nurse practitioners out to demonstrate the difference that we can make to clinical practice, to clinical leadership in New Zealand.
I think nurse practitioners should be supported to tell their own stories so that our community, so that anybody understands better the contribution, the roles, the outcomes of nurse practitioners.
Well, the drive for the nurse practitioner scope of practice and role in New Zealand was around improving equitable access to care and improving equitable outcomes. And that's what drove me in the beginning, and I registered in 2003 and still keeps me going today.
I wanted to make difference for families. I wanted to role model to other, particularly Māori nurses, that if I could do it, they could do it. I wanted to be able to provide holistic care without standing and knocking on someone else's door to complete a part of that journey. And I felt I had something different to offer to the families that I was working alongside.
I work in palliative care, and I had a really traumatic experience with losing my dad at a young age, and I didn't want anybody to have to live through that experience like I did. So I had this vision in my head of a good death and what I want that to look like, and I knew that the only way I could achieve that fully was being an MP. So that's my drive.
I would say, if you wanted to become a nurse practitioner, be prepared. Have the conversations with your employers or the places that you want to be working as a nurse practitioner. Have the conversations with your families, with your colleagues. Think really carefully about, is it the right time for you, because it is commitment. But also know that at the end of it, it's really fulfilling. You know, the contribution, the outcomes, the satisfaction of working alongside people is immeasurable, really. Yeah.
Just do it. Grasp the thistle, as they say. But think carefully about it. It's a big commitment. It's a very steep learning curve. There's a lot to learn and develop, but it's very rewarding, and just go for it.
It's hard. It's not a walk in the park, but it is so worth it, and I'm still buzzing on it. I'm so proud of the people that I did it with. I met the most amazing people. We had the most amazing lecturers, and yeah, I would do it again tomorrow. Well, maybe next year, because I need some time off.
I would absolutely encourage it. I know there's a lot of negativity about health, but people always need care, and I've been a nurse now for nearly 50 years, so I don't regret a minute of it.
A really strong support network. It's really hard to have people understand what MPs do, and I think so if we stand together and tall, then a community driven by MPs will be a good one. So my story is basically, to cut a long story short, I was a teen mum. So I had my first daughter when I was 16, and I had a lot of negative backlash by doing that. My partner and I have been together for 21 years, and we've worked really, really hard from the bottom up. Like, I didn't get school C, I didn't do any of the things right. We've done nothing right in life, but I decided that actually I want to show all those haters that anything is achievable, and have done it, I think. I'm still not satisfied, so PhD, here we come, but one day. But yeah, that's why I do it. That's why.
Well, my story, because that's what we've been talking about today, is I was a nurse practitioner in the UK. I was quite autonomous, as in I worked in ED, and then I became a midwife because I wanted to do the flying doctors stuff. And I joined the military, so I worked quite autonomously as a flight nurse. And then I was just talking to a colleague, and she said, nurse practitioner, that's your next logical step. You can't go backwards into a hospital or primary care environment and not being able to work autonomously. It will kill you. And she was right. The study nearly killed me, I'm not going to lie, but again, it was great being surrounded by other clinicians that were sort of aiming for the same thing, being patient-focused and holistic, and providing that whole wraparound care that as nurses we want to do all the time. And so, yep, I trained as a nurse practitioner in the UK, but family stuff, we wanted to emigrate just for a better work-life balance. And so it did take a little bit of a negotiation, but that's a long story, to actually get registration in New Zealand as a nurse practitioner. Luckily, I didn't have to redo my master's. But anyway, luckily the language is the same, the drugs are the same, most of the clinical guidelines are the same. So we emigrated in 2012, and in 2014 I became a nurse practitioner here. And so now I'm the clinical lead for the Sexual Assault Service in Masterton, or the Wairarapa. We cover the whole of the Wairarapa. And I also work part-time in the Little Emergency Department at Masterton Hospital, and feel part of the community and feel that, as with myself and another nurse practitioner, we're the only forensic examiners in the Wairarapa. So the service had fallen down a few years previously, and we stepped up and said, yep, that's a role that we could fill. And some other nurse practitioners had led the way and become accredited forensic examiners. So they had, made those changes. So we just followed in their footsteps. But it really means, I hope, that we've now got a sustainable service for our locality, which I feel is really important.
So what I wanted to share with you today is that now that I'm looking at my retirement in a year or so, I'm always thinking about succession planning and how we can recruit and encourage nurse practitioners and GPs and advanced nurses to come to rural areas. So I work in Pahiatua in a rural general practice, and we are leaching staff. We're leaching GPs with burnout. We're not attracting younger people, young GPs, young nurse practitioners, and I think we have to be innovative about how we attract that. The organisation that employs me has no money for that, does not value that. That's kind of not a surprise. As a nurse, I've been working against that for my entire career. So we've always had to be innovative. And I was talking to a patient one day who was on the county council or the regional council, and she mentioned that she was also on the Bush Trust. And I suddenly picked up and realised that the Bush Trust actually owned the site, the building that we work in and practice out of. And I said, what's the goal of the Bush Trust? And it turns out it's a community-based trust to fund health. And we all know that we can't recruit, and so many of the patients who care about their region are saying the same thing. Why can't we? What can we do? And I suddenly thought, well, what is it that stops us doing that? And when I talk to the nurses, actually, who would be the ones to say, how can we encourage local people? What the biggest barrier for them is time and money. A lot of them are women. Most nurses are women. So they're also the child bearers. So they're also the least paid. So how can we improve that? So I thought, I wonder if I could pitch a sales pitch to the Bush Trust, and I did. And that was to release the nurses to undertake professional development, paid daily, paid for 1 day, 10 days per semester. So that's not for going to attending their university, it's to actually stay at home and study, and that they would be paid, or the organisation would be paid to replace them, to enable them to succeed. And I'm pleased that we've just heard that the Bush Trust has $20,000 annually to support that in the Tararua region. So it's just, yes.